Welcome to Performance Plus annual employee training session on bloodborne pathogens. In this training, you will watch a short video on bloodborne pathogens and then review the highlights. We will pause for questions throughout if necessary and have a Q&A session after.
Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include but are not limited to hepatitis B virus HBV and human immunodeficiency virus HIV associated with AIDS. OSHA originally developed the bloodborne standard for healthcare and hospital employees, but it's been expanded to include any occupation in which reasonably anticipated contact with blood or other potentially infectious materials may occur, including someone who may be responsible for the cleanup of blood or body fluids, or even those who remove trash within these settings. There may be potentially infectious materials, and how you take care of them can literally make the difference between life and death. Most occupational exposure to bloodborne pathogens occurs when the pathogen comes in contact with the employee's mucous membranes, like the nose or mouth, or breaks in the skin, like needle sticks, human bites, cuts, or abrasions. Body fluids, such as blood or vomit, and in some instances, saliva can potentially contain bloodborne pathogens, but you can easily protect yourself from coming into contact with the fluids by following universal precautions. The Centers for Disease Control and Prevention, or CDC, established the universal precaution approach, recommending that blood and certain body fluids from all patients be considered potentially infectious, and that infection control precautions be taken to minimize the risk of exposure. The best defense is a thorough offense. Always follow universal precautions as well as your facility's exposure control plan when handling contaminated materials. This means that at all times assume that all blood and most body fluids are contaminated with bloodborne pathogens, and that you should follow proper protective practices when handling a cleanup or an exposure. Using universal precautions and the labeling or color coding is sufficient to let all employees know that compliance with universal precautions is required. Bags or containers must be properly labeled and color-coded red or orange. Remember that needles or other sharp objects may be hidden within the garbage bags or receptacles. Besides protecting yourself, you are responsible for containing the bloodborne pathogens and decontaminating the area so someone else isn't exposed. It is crucial to clean and disinfect the area with the appropriate disinfectant cleaner after a cleanup procedure. Always remove and dispose of your gloves and other equipment in a properly labeled container or a red or orange infectious waste bag. Thoroughly wash your hands with a hand cleaner immediately after you remove the gloves, goggles, or other personal protective equipment. Good hand washing helps reduce the spread of infection and disease. All containers and cleaning equipment, such as mop buckets and tongs used during decontamination, must be disinfected. Following use, if there is any chance that you've been exposed to bloodborne pathogens, contact your supervisor immediately for proper care instructions.
Let's recall key learnings from the video. 1. What is a bloodborne pathogen? Bloodborne pathogens are infectious microorganisms found in human blood that can cause diseases like hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. 2. What are universal precautions? Universal precautions mean treating all blood and bodily fluids as if they are infectious, regardless of the perceived risk. 3. Why is PPE so important? Understanding how to protect yourself from exposure is critical in maintaining a safe workplace.
Exposure to bloodborne pathogens can happen through various types of transmission, including but not limited to mucous membranes such as eyes, nose, and mouth, needle sticks or other sharp objects, open cuts or wounds, and sexual contact. Besides blood, vomit, and saliva, there is a long list of potentially infectious materials. Please take a moment to review the listed materials and ask questions if you have them.
The next key takeaway from the video is universal precautions. What does this mean again? The practice of treating all blood and bodily fluids as if they are infectious, regardless of the perceived risk. And why is it important to practice universal precautions all the time? It creates and fosters a cleaner, safer, and healthier environment for our coworkers and clients. Always use appropriate protections such as gloves, goggles, and face shields when dealing with potential exposures. This brings us to our last takeaway from the video.
PPE, or personal protective equipment, is your first line of defense. Always use appropriate protection, such as gloves, goggles, and face shields when dealing with potential exposures. Proper disposal of personal protective equipment, PPE, is crucial to prevent contamination and the spread of infectious materials. Here are the key steps for the safe disposal of PPE. 1. Remove PPE carefully to avoid cross-contamination or exposure. 2. Proper disposal is a crucial step. It must go in a biohazard or color-coded container. 3. Wash your hands thoroughly. The appropriate amount of time to wash your hands is about the length of the Happy Birthday or alphabet song.
So far, we have talked about bloodborne pathogens, universal precautions, and PPE. There are a few more quick topics to discuss, then we are finished with this year's bloodborne pathogen training class. 1. Handling of sharps. 2. Cleaning and disinfecting the contaminated area. 3. What do you do if you are at risk of exposure? Sharp objects, like needles, are one of the most common ways bloodborne pathogens are transmitted. Always dispose of used sharps immediately. Use an approved puncture-resistant container and never try to bend, recap, or remove needles. If blood or bodily fluids are spilled, clean and disinfect the area immediately using an EPA-registered disinfectant. Ensure you're wearing the right PPE during cleanup and dispose of contaminated items properly in biohazard bags. What do you do if you are at risk of exposure? You should act quickly. 1. Immediately wash the affected area with soap and water. If eye exposure, use water and saline for 15 minutes. 2. Report the incident to your supervisor right away. 3. Follow the post-exposure plan. This may include a visit to your primary care physician or our workers' comp facility.
We have reached the end of Performance Plus's annual Bloodborne Pathogen training class. After this final recap, there will be a few minutes to answer some questions. Remember, follow universal precautions. Use PPE to protect yourself. Handle sharps and contaminated materials safely. Clean and disinfect properly. And finally, act quickly in case of exposure. By staying informed and following these guidelines, you can protect yourself and others from the risks of bloodborne pathogens. Thank you for your time and attention. Are there any questions we can answer?